what is the most appropriate imaging study? 45-year-old woman. What's the ED? Acute onset, severe left lower quadrant abdominal pain accompanied by nausea and vomiting. History of Crohn's disease, multiple abdominal surgeries. On examination, her abdomen is distended and tender. In the left lower quadrant, bowel sounds are absent. Non-reducible mass palpable in the left lower quadrant. Okay, so if she has like a non-reducible mass, probably like a hernia. But she has a history of Crohn's, multiple abdominal surgeries, could be adhesions. Let's see. And then left lower quadrant, I usually think like diverticulitis, UC, something like that. Okay. So let's see. Most appropriate imaging study. An X-ray, you're not going to get one. An MRE, I don't know what that is. A barium enema. What's the problem here? She has a non-reducible mass, nausea, vomiting. She could have like cancer. I'm not really too sure. Abdominal CT with oral contrast. Abdominal ultrasound. I mean, abdominal ultrasound is going to be quick, easy. She's in the ED. I guess we're just looking for fluid or she's had multiple surgeries. Don't know if we're gonna get much from it. I mean, yeah, I get confused here. Non-reducible mass. Reducible numbers, I'm thinking hernia. I don't know if you can see a hernia with an ultrasound. An ultrasound's not a bad choice here. I just don't know what the best answer is. I don't know.
Sure. So you're leaning more abdominal ultrasound and
I do because I think it's like fast, cheap, and it's easy as opposed to
sure,
something like CT.
sure.
But I don't know. Or even
Okay.
X-ray is not a bad choice, but I don't know if you would see them. I don't know. So yeah, I think so.
So let's see kind
Let's
of
see.
what they say here. So you're worried about like a small bowel obstruction here due to maybe a
Okay.
hernia, right? So
Uh,
multiple abdominal surgeries, right? It's a non-reducible
Adhesions.
mass. So key
Okay.
thing here is what can help you actually is if you do oral contrast, meaning that you can see right the bowel, the lumen of the bowel, because it'll light up because you just swallow that barium, and then a CT ultrasound, right? But it's less sensitive and it's not as good for small bowel obstruction as a CT
Okay.
scan. So it's just slightly better. And remember, CT scan, right, is pretty cheap and fast too.
Okay.
Ultrasound is off, it's cheaper, faster, but it might not be as good of an image study here.
Okay.
Um, so I would say abdominal CT with oral contrast because you can actually see because when you drink the contrast, it fills the lumen of the bowel, and so it's going to give you a really good picture.
Okay. I mean, it makes sense. I just don't. I knew it was like hernia-esque, but could be some other things. I'm just not
Sure,
sure, like
sure.
which is
So, yeah,
which.
yeah. So you're just kind of worried here, right? Is that the small bowel might be trapped somewhere, right? And so to
Okay.
really evaluate that super clearly is if you drink contrast, it'll light up the lumen, and then it'll have this area where it's kind of stuck. So then that's going to be kind of the best imaging is a CAT
Okay.
scan here.